This is Terry Lanier performing a newborn assessment for Dr. Piper Neal's Advanced Health Assessment class. For a newborn, the initial assessment will give us an idea of how the newborn is reacting and adapting to extrauterine life. Some questions you might want to ask and that are very important before the birth would be, what is the gestational age? Is it a term infant, which would be 37 weeks or greater? Was the amniotic fluid clear? If there was meconium present in the amniotic fluid, there's a possibility that the infant could have aspirated that, which can lead to aspiration and needs to be addressed immediately at birth before the baby takes its first breath. You also want to know if the baby's breathing or crying. If they're not, you would start the NRP resuscitation with the least invasive, such as warming and tactile, moving up to the more invasive procedures of intubation, suctioning, and if necessary, medications. And you want to look at the baby's muscle tone. That will tell you whether they're responding and have good tone, or if they're limp. Once the baby, you have determined those answers, at birth, at 1 minute, an APGAR score is obtained, and each of 5 categories is rated 0 to 2, and it's obtained again at 5 minutes, and the score can be from 0 to 10. This also gives you an idea of how the baby is adapting and adjusting to extrauterine life. Another useful tool is the Ballard Gestational Age tool, which rates different categories such as eyes, ears, genitalia, skin, to give you an idea of the gestational age and the physical maturity of the infant. Once the infant is born, things that you're going to be looking for would be the presence of lanuga, which is a fine hair that covers the body, and also the presence of vernix, which is a cheese-like substance that covers the baby. Those are normal findings. You want to look at the baby again and determine if they're responsive. Are they crying? Are they lying, doing nothing, and are limp? Several measurements that you want to obtain would be an occipital forehead measurement with a tape measure using the sonometer side. A normal term newborn should have a head circumference between around 30 to 32 centimeters. You also want to check the chest circumference at the level of the nipples, and that should be around 20 centimeters. You also want to measure the length of the baby by extending the foot, making a mark on the sheet and a mark at the head, and measuring that in centimeters. Normally it should be around 19 to 20 inches, which is about 35 to 38 centimeters. There are several reflexes that need to be assessed in the newborn. One is the rooting reflex, where you stroke the infant's you stroke the infant's cheek. They should turn and open their mouth and attempt to suck on the side that you're stroking the cheek. You also want to assess whether their sucking ability by putting a finger into their mouth. Suck should be strong and firm. We also test the Moro or startle reflex. This also it can be done in the manner I'm going to show, or you can also clap loudly to see if the baby startles, which gives you an idea if the baby can hear. By supporting the baby in a sitting position, holding the arms, you allow the baby to drop a few inches and release the arms. The arms should extend, the fist should curl, and the hand should make a C. You also want to assess the tonic neck. You would turn the baby's head to the one side. The same side, the arm and leg should extend. The contralateral side, they should flex in the fencer's position. You would then turn the baby's head to the opposite side and repeat for the tonic neck reflex. Gallant's assessment or trunk incurvation You hold the baby in the ventral position, stroke along the side of the spine, and the baby's hips and legs should turn towards the side that you're stroking, which is a normal finding. You also want to test their palmar grasp by putting your finger in their palm, and they should grip tightly onto your finger. Absence of any of these reflexes can indicate a neurological disorder, and persistence of these reflexes past their normal developmental stage, which usually is about by 4 months. Most of these have disappeared, and the baby has developed and gone on past these primitive reflexes. You also want to check the baby for hip dislocation by having the baby on their back. You flex the knees and hips at a 90-degree angle. You abduct the hips and listen for any clicks. That would be the Ortolani's procedure. Barlow's maneuver is while they're in the same position and you have your finger on the outer trochanter, greater trochanter, you adduct the hips and the head of the femur should stay in the acetabulum. You want to inspect their fontanelles. The anterior fontanelle should be open, soft, and flat. The posterior or occipital fontanelle sometimes can be closed at birth, however, it should be open. The head should be symmetrical. You look at the eyes, are they symmetrical? You look at the ears. The level of the pinna should be at the inner canthus of the eye. You want to notice for any ptosis. You want to look at their skin, hair, and hands. For the full-term newborn, their skin should be soft and pink, and there may be some mild peeling, but that's normal. The presence of Mongolian spots, which are normally seen on the buttocks, is normal mostly in the Asian population. They can also have some macular stains on the back of their necks. Those are often called stork bites or strawberries, and those are just vascular, and that's normal. You want to check the chest for equal chest excursion. You would listen for heart sounds, and the assessment of the heart, lungs, and abdomen in a newborn is the same as for an older infant and also for an older patient. The lung sound should be the same. Heart sounds are the same. You want to listen for a murmur, which could indicate the presence of a congenital heart defect. You also want to palpate the umbilicus as well as their inguinal areas for any hernias. You want to check for head lag by lifting the newborn up. They should have significant head lag, which should be gone by 4 months. You want to check their nose and mouth for patency. Obviously, you would be checking the nose to check that both sides, both nares are patent and there's no evidence of choanal atresia. You can do this by passing a small catheter up each side of the nose. You would assess the infant's mouth, looking for any cleft palate or cleft lip. You would check for the breasts. They should be small nipples with a small areola. There also may be some supramammary nipples or an extra nipple, which may not be immediately evident because they're very small. If those are found, reassure the parents that those are normal and they will not develop as breasts into puberty. For the female, you want to look at her labia and clitoris. They can be enlarged because of maternal hormones, and also there may be some blood in the diaper, which is normal and disappears, and that's due to the maternal hormone influence. For the male, you want to look at the penis. making sure the position of the urinary meatus, looking for any hypospadias. And you want to check the testes to make sure that they have descended. The full-term neonate should have deep rugae and a dark color to their scrotum. There are many parts of the assessment for infants and children that are similar to the adults, such as lung sounds, heart sounds, breath sounds, abdomen, but there are some significant differences that need to be addressed. Infants are obligate nose breathers, so with the newborn you want to make sure that their nose is cleaned out and that there's no amniotic fluid or meconium in their nose so that they can breathe. You want to make sure that their mouths are cleaned out. There's no amniotic fluid in there. When you're listening to their lungs, because of the small size of the chest, breath sounds can be referred from one side to the other, so listening laterally is very important. When you're listening to the heart, you should listen to listening for a murmur, which can indicate, as I said earlier, a congenital heart defect. Acrocyanosis, which is cyanosis in the hands and feet, can be is a normal finding in newborns. Central cyanosis, however, around the mouth and nose can indicate respiratory or cardiac defects. This concludes the newborn assessment for the advanced health assessment class. Thank you. Do you hit the red button? Is it stopped?